or maybe this is your first time at a Health High call, we do these calls every other, or the second and fourth Thursdays of the month. It's 30 minutes, and we present an innovator. And I've been really pushing today, and I'm excited because this is something that I think really will speak to a lot of the people that are working on supports for people with developmental disabilities. And so I will go ahead and introduce Dustin. And I thought about how I would introduce Dustin. And I think that how I would do that is, you know, you meet someone and you suddenly realize that they think about a situation exactly the same way you do. And I've even been spending a lot of time figuring out how to make it happen. And I feel like Dustin and I met each other and we're like, you've been doing that? So have I. Oh, you've been doing that? Oh, I have too. And it was this really great, and I benefited from it. And I'm really happy. I did a presentation to his group a couple months ago, and it's great to have him here today. And we have a good turnout. So really, I'm just going to turn it over to you, Dustin.
Great. Thank you. I'm excited to be here, and thanks for the opportunity to talk with you. The only thing that would make it better for me is if I was actually in Alaska with you, but that's not possible right now. Look forward to kind of just sharing with you briefly about kind of Disability Cocoon and what we do and how we do it and our mission and who we want it to benefit. But I think for you to really get a sense on kind of why I started Disability Cocoon and why it kind of has evolved to where it is right now, I like to start a little bit just briefly about myself and my background, because it kind of leads into that. So I actually started as a direct support professional, a caregiver for adults with intellectual developmental disabilities while I was attending Purdue University here in West Lafayette, Indiana, where I live. Didn't really know what I was getting into. I answered an ad in a newspaper. That was back when ads were still put in newspapers, and ended up being placed into a group home and a waiver setting, so a living type setting. And kind of fell in love with the field. And after graduation, I accepted a position as the director of the agency, and had the opportunity to kind of run that agency here, which was a IDD service provider, mostly residential services. And in the course of doing that, I met one of our local competitors here in Lafayette, Indiana, who was starting this thing that he was calling a telecare system, which was the country's second remote support provider, called Rest Assured. So was lucky enough to lead that position with the provider agency and help to start and found Rest Assured, which provided remote supports to adults with disabilities. For those of you that may not be familiar, it's basically linking an individual in the home to an off-site caregiver that can see into the home, get sensor alerts, interact, prompt, cue, coach. So in that role as the executive director, I was doing a lot of work in educating the disability community across the country. And when I say educating the disability community, it was two different things that we were trying to do. One was to create new reimbursement and regulatory environments for this new service because, well, one, we were a company and we needed to have funds that we could draw down. But two, it was a huge cost savings to the system, and the individuals that were receiving this service really loved it. The second part that I had to do was to kind of create cultural change within the disability system in certain areas of the country. Because as you can imagine, in 2006, if I walked in to tell somebody, we're gonna put cameras and sensors in your son or daughter's home, and they're not gonna have a caregiver in the home during that period, the person's gonna be remote. In 2006, that was pretty new concept. So that cultural change was something else that I was also really working on pretty hard. After about 13 years of doing that, I was sitting at my desk one day at Rest Assured, and I kind of realized that, you know what, there isn't one entity that, as the executive director of this tech company, that I can go to that is going to represent my company's needs. You know, there are lots of trade associations in our industry, and that sure would have been great for us. But then I was also thinking about that cultural change that we all had to do at Rest Assured. And man, that entity would have been a much better platform for something like that to occur. And that was the genesis, or the idea of Disability Cocoon, was to create a place where people could go that was neutral, was not selling any products, that was just a resource to further the advancement and the use, the appropriate use of enabling technologies, assistive technologies, remote sports, all kinds of technology to improve the lives of people with disabilities. So I had the idea, I kicked it off about almost 2 years ago now. And we're doing a variety of different things, which I'm going to kind of go over here today. But so our mission and the mission of Disability Cocoon, as you can see on your screen now, has always been to just try to be that resource and to make technology implementation in the disability arena as easy as possible for people. And when I say people, we are really helping people, these types of roles, provider agencies, service providers, professionals, people that are doing case management or service coordination, families and self-advocates, so people with disabilities themselves, and then also some of the governing state, national, local governing regulatory type entities. And we do a variety of different things, and I'm going to kind of skip through this to get to this graphic. I'm really proud of it. Just put it together like 2 days ago and put it on the site, so you guys may be the first to see it, who knows. But this does kind of sum up and show everything that we do, and I hope what is a clear way to describe a pretty complex ecosystem of things. We try to organize everything that we do into really 3 different big categories to help people discover technology, just to see what's out there, and once they figure out what's out there, they're going to want to learn about it. How do we apply this? What's the best practices for applying this type of technology that I just found to this use case or this person's life that I support? And then really giving people some tools to go out and implement these things. As you can kind of see on the graphic, if I start on the left-hand side here, there's a variety of pretty standard things that a lot of organizations do. We write a newsletter that goes out every week with ideas and tips and new products. We have a blog where we're writing articles and obviously sharing some things on social media. So those are kind of in the early discovery where people come in and they can get things without really committing to being very engaged with Disability Cocoon whatsoever. Then we do these, we call them tech fests. They're basically conferences that we hold around the country. We did 7 of them last year, where we are bringing in all different kinds of tech vendors, and then inviting the disability community in to put their hands on some things, experience it, bringing in the experts from different areas, and holding one-day conferences. The reason we call them tech fests is because I've never, actually I did. I held one in a hotel ballroom, and I didn't like it. We always try to do them in some fun, unique place, museums, parks, etc. So that's kind of an in-person learning experience. The other thing that we do, very similar to this, which Kim was talking about, that Kim actually spoke on, we do these every week. Tech huddles is what we call them, but these 30-minute quick sessions where people can get exposed to something new kinds of tech, demos from various tech vendors, and learn very quickly. And then we also do what we call workshops, which are Zooms like this, where we dive really deep into a specific topic. So these are kind of introductory type learning opportunities. Workshops are really deep dives into a specific area of a person's life. So we may do a workshop on how to prevent elopements, detect elopements, those kinds of things. How to help somebody manage their medications with technology, those kinds. So an area of a person's life or a specific type of tech. So we've done one on remote supports, where we just go, but we go deep and try to give everybody basically a blueprint on how to do this and who to do it for and how to do it appropriately. So as you can see, the big circle here in the middle is a new program that I'm going to show you here in just a second, that we're calling Shift. And this goes back to the original vision of Disability Cocoon and that cultural shift that needs to occur.
Yeah.
So what Shift is, it is an accreditation program for service provider organizations, a credentialing program for direct care staff, caregivers, and a certification program for professionals, which teaches them through a bunch of online coursework, projects, exams, and ongoing learning opportunities by connecting with other professionals, it gives them the tools and the knowledge to really become professionals at integrating technology into the support plans of people with disabilities. So you can see that the tech fests and the tech huddles and the workshops are kind of attached to Shift. The ongoing learning part of Shift is where we are actually archiving all of these things here and updating Shift with new information from these three kind of things that we're doing, with new information, new demos, new tech, those kinds of things, so that Shift becomes a learning opportunity that people can go to and continue to learn. We did not want Shift to be a come in and take these 5 courses and do your exam and do your projects and then you're done, right? Because technology is changing so fast that what we present today may not even be applicable a year from now, you know? So we wanted to make it a learning community where people can share ideas, communicate, and interact, very much like a social media channel. A part of Shift and a new project that I'm just getting ready to launch is a partnership with a company called Atvisor, and I'll show you that here in just a second. It is a platform where people can come in and search by desired outcomes. I want to help Bob with a seizure disorder. I want to help Mary, who has limited use of her arms and legs, right? I mean, so ways that you can search based on desired outcome for the person that you're looking to serve, and then generating tech recommendations for that person. And then if we get over into the implementation side, we are doing a lot of consulting. Most of the consulting that we're doing right now is with state developmental disability divisions and helping them. I'm sure if you've not heard, there's a pretty big movement going across the United States right now called Technology First, that a lot of states are pushing throughout their Medicaid systems. And we are just helping them to organize that in a way that they can do that cultural change, get the regulatory environments right, reimbursement structures right, and those kinds of things. Also, some kind of side projects that we're working on. We actually have a grant in Wichita, Kansas to help all of the providers in Wichita, Kansas transition to this technology first mindset, and some other things that we've been doing, but lots of presentations and conferences and kind of one-off training. So this part of the graph, I always like to tell everybody, it's kind of like the catch-all bucket. It's whatever you want us to do and whatever you need us to help you with, we'll do that. I mean, it's kind of wide open that way. So at a very high level, that's what we do. I did want to kind of quickly show you the Shift platform, just so you can kind of get a sense on what this looks like. I'm actually logged in as a user right now, where you could come in here, and here would be your learning plans. So where your courses that you have to complete. Here's an activity stream of all of the other things that are occurring around you, your colleagues. You can have access to other content outside of your learning plans to continue to learn and grow. You can sign up for webinars and things of that nature that we're hosting here on your calendar, and just a variety of different things. So it's interacting, sharing ideas with other people. So that's Shift. It's going to be launching in next week, Wednesday. Here is Atvisor. So this is an Israeli-based company that created Atvisor that Disability Cocoon has partnered with to bring Atvisor to the United States. And pretty much our role is going to be to enroll and onboard suppliers of assistive technology and enabling technology. So all of those remote support vendors and automated medication dispensers and all of that other stuff that we see out there in the market in the US, we're going to be uploading all of that stuff in here, and then people can come in and search for specific types of devices based on an individual's needs. And of course, because of Zoom, and if we can figure out how to get that bandwidth increased here real quick from your person, Jacqueline, that'd be great, because it looks like I'm running a little, I'm kidding. Looks like I'm running a little slow. But as an example, let me, here you can say, I want to help Bob with seizure disorders, and it'll spit out the different types of tech that can assist individuals with seizure disorders. The really cool part about this thing is that you can actually create a profile for people. Let me see if I can refresh this. It might have just been that I was sitting there so long. It logged me out. You can create profiles for people. So this actually facilitates remote AT assessments that can be done, where you can jump on here and create a profile for an individual. I created an example profile here. Let's go ahead and just take a look at this. Where you can give their symptoms, their diagnosis, depression, diagnosis, depression, CP, autism. Here are some of the symptoms that that individual is experiencing. And then it will basically just pump out a list of tech that could be used to address that person's needs. So the whole idea behind this Atvisor is that we do want to embed this within Shift so that once people get that education and understand from a fundamental level, how do we go about approaching technology and service planning, we can now directly go to find technology and hopefully be able to improve people's lives. So that is a pretty high level of what we're doing. The main goal of what we're trying to do with all of this that I've been talking about is to, again, make tech easy for people so that the individuals that are out there can benefit from this technology, and the people that are serving them feel confident and empowered and that they have the knowledge to do this so that they can help change people's lives, because that's really the ultimate reason for it. We are also trying to do this to help create some efficiencies in our service delivery systems and our service models, because I feel that tech is going to allow us to not only improve people's lives, but to do things a little bit more efficiently than we are right now. And I don't ever think that technology is going to ever completely take the place of the need for humans to interact with other human beings. And for that direct care position, we will always need those folks. I was one, I know how important they are, but I think tech will help everybody do their jobs better and ultimately improve people's lives, which is the big goal. So with that, I can't believe I did that whole overview in 18 minutes, but we did. So I'll kind of pause there and see if you have any questions.
Thank you, Dustin. I really appreciate it. And I just want to say one thing before we open it up to questions. In working with providers and the system here, it's overwhelming to think about knowing that technology is going to play a role in people's lives, and how do you bridge that and figure it out. And I particularly asked Dustin to talk about Shift and the technology training that he's providing, because I think that is something that could be really helpful for us here in Alaska. So thank you, I really appreciate it. And so, yeah, does anyone have questions? You did a great job with time, so we have almost 10 minutes if there's any questions for Dustin.
Yeah, Kim, this is Jake.
Hi, Jake.
Well, thanks for.
Oh, did we lose Jake?
Yeah, I think it kind of.
Looks like we lost him. I bet he'll be right back in. So while we're waiting for Jake to
find unmute.
Oh, okay. Go ahead, Emily.
Okay. I had a technology problem. Had something on my screen. I couldn't get out of the way to unmute myself. Justin, this is really just exciting to hear. I'm truly a later generation IT novice, but I'm so excited about the prospect, and I feel right now in my agency there, we have few staff resources. I'm in Fairbanks, Alaska. We are a very lean staff right now, as many programs are in Alaska, probably around the country too. And so, I feel like in a way I'm kind of pushing this concept, and it's going to be me, I think, in my agency right now, just given everything that drives it, which is exciting, except I certainly feel very unprepared and unskilled, and even creating a plan. And so many of the things you really excited me, like Shift, in which we can include them in individual service plans. But that made me think, how would I get help in developing kind of the overall long-range plan for my agency that would impact people's lives. I mean, the big picture. And then, of course, beginning to divide that into phases that I could understand and communicate out and seek funding for as necessary.
So what you just described is exactly what Shift is designed to do, is to help an agency embed technology experts within their organization. So by creating those, that professional role within your organization, and that may be 1 or 2 or 3, depending upon the size of your organization, but giving them the skills, but then taking that one step further in helping your agency to create those processes. You have templates and documents, and part of the Shift accreditation for an agency is to actually build that out as you're going through the Shift curriculum, so that you have a plan and a structure by which you can then continue to grow and evolve as an organization. So that is exactly what Shift does.
That's great. Well, I'm so glad to hear that. I was wondering if that would be, available. So that's fantastic. And, definitely we have a lot of younger people that are quite tech savvy. And so I know there are some key individuals that could be part of this. It's just that I need to be able to guide the process and find the resources. And I guess that overall big plan that I can share with my board and apply for funding, using. So this is great. Thank you.
Yes.
I appreciate that.
And don't let the assumed tech novice part slow you down, because it should not be a barrier. And I'm sure you can do this. So.
Yeah. Well, I think it would be fun and probably a little bit challenging, but I always like new opportunities. So this is, I think, a good opportunity to step into this world. So thank you for that encouragement.
So I see that Jake is back on, and so I'd like to give him a chance. And then I think Kai has a question after that. So Jake, do you want to try it again?
Yeah, thank you. I'm not sure what happened. Thanks again, Dustin. This has been a super informative presentation, and I'm really impressed with what I see. On the Shift platform, who are you reaching out to first? Are you going, to the agencies to get them to provide people, or are you going to providers or consumers? I'm just wondering how you're driving the need for the platform.
So we're doing it through a variety of different ways. The first is that learners can enroll as individuals. So if a direct care staff wants to advance their career and get an extra credential tagged on there, they can just enroll themselves as a tool to advance their career. Same thing with professionals. The other avenues, and the big ones for us, and really where we're kind of promoting this the most, is within state disability divisions, your Medicaid systems. At the state level, we actually have 3 states right now that are going to be involved in our pilot program: Tennessee, Maryland, and Washington, D.C., that are actually paying for this to equip the provider community in their states with this knowledge, because they know that once they start using tech, it's going to really drive down the cost of support within their Medicaid system. But also directly to provider agencies like Emily's is the prime example, that are looking for change and just don't know how to even start the process or where to start. So we're kind of looking at that level. Also, there's been some interest by several MCOs. Wisconsin is a managed care. Medicaid is managed by managed care entities, and they're also looking at this as a way to educate their members. And then some of them are even thinking about requiring it for vendors that want to enter their networks. So just a variety of ways like that. Yeah.
Cool. And then the second part to my question, which isn't actually related to the first one, but I did sort of make a note when you mentioned working with the state agencies, and oftentimes when people see the state agencies looking for efficiencies, it doesn't necessarily mean like increased quality of care to the consumers. And I think technology has the ability to actually, if implemented properly, increase the quality of care to consumers. Do you, as part of the Shift, do you have a strategy for making sure that people don't just, like you said, eliminate the people, the hands on the ground, or, is there a consumer advisory side of this or anything like that?
We do have an advisory committee that is composed of 10 people. 3 of those are self-advocates, so that they are having a voice in how shift is created. And that is another kind of core fundamental of shift that we've built in there, is that for technology to be done right, and when you're doing technology the right way, if you start with the tech and then try to figure out which individuals we can use this tech on, that's the wrong approach. We have to start with the individual's needs first and make sure that it's something that they want first, that it's going to work for them, and really start with their needs and then back into the technology. So that's kind of a core piece of the educational component of shift. And then one thing that I forgot to describe even real quickly, I know we're almost out of time, this is the most exciting thing to me, like crazy. Atvisor right now, it's that search thing, right? Where you go in and you search, I want to find this for this person. What we want to do, and what we're applying for a NIDLR grant right now, is to build out 3 different modules within Atvisor. The first is a search, which then gets you to a vendor. But in most states, if you're wanting to buy that technology through a waiver program, there are some very regulatory required processes and methods that you have to go through to get that device purchased. So that will be the next piece of Atvisor, is a procurement management software that agencies can use to ensure that they're buying tech in the appropriate way based on their state's regs and based on their state's funding requirements. And then the third piece, which is the best, kind of to your question, Jake, is that there will actually be follow-along questioning and data collected through Atvisor that ensures that the technology that is purchased is being used the right way, and asking how effective that piece of technology has been for that specific person, and then looking at the cost savings that were also realized. So we're going to start with the person, and is this tech effective for this person, where family service coordinators, providers are rating the technology that they've purchased. And then the data from the rating of the tech will actually feed back into the search, so that the searches and the results of the searches become better and better and better and better. And then we're recommending more appropriate solutions, which would then drive better outcomes for people. So that's the long-term vision for Atvisor.
So we're out of time. Dustin,
Yeah, sorry.
Awesome. I think if you could share your contact information, I know people are interested in following up with you. DisabilityCocoon.com, and I know that's how I got in touch with Dustin, is just to go on the website and contact him through that. He's really responsive, so that's probably.
Thank you.
Yeah.
Thank you so much. This was.
You're welcome. Thank you, everyone. Appreciate your time, and thanks for the opportunity. Enjoy Alaska.
Thank you.
Bye.
Thank you.